Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Welcome to Ethical Perspectives on the News. I am your host, Karl Cassell, and today we want to discuss childcare in Iowa. There are many issues confronting legislators, parents, teachers, and communities at large when it comes to addressing the gap in cost versus adequate childcare in the state of Iowa. There is a consensus that as a state, we need more options, but they need to be affordable. So today we're going to discuss the options available to Iowans, but also explore some innovative opportunities as well. Joining me today, we have three experts in the field of childcare. Kylie Spies, LMSW, from Prevent Child Abuse Iowa. Hello.
Hello, thank you for having me.
Oh, our pleasure. Next, we have Jillian Herink, Executive Director of the Iowa Association for the Education of Young Children. Hello.
Good evening.
Good evening. And finally, Jennifer Ohman-Rodriguez, author, child development specialist, and future pastor. Greetings.
Hello, thanks for having me.
Oh, my pleasure. And so we just want to open it up with some general questions. What do you see right now regarding adequate child care for children here in Iowa? What are some of the things that you guys have seen in the recent past?
Well, certainly we hear about the lack of affordability of childcare for families in Iowa and accessibility. But one of the things that we often don't hear about is lack of childcare providers in Iowa because of the low pay and lack of benefits. So that's a unique thing that we don't often talk about.
Childcare is kind of one of the rare businesses in this country that really doesn't work on the consumer or the provider side. Margins are so thin for those providers, but those costs are still so high for families. And at Prevent Child Abuse Iowa, we focus on those supports to families. And we know that Iowa leads the nation in households where all the available adults are working when you have children under 6 in the household. This is a very real, very urgent situation for not just for families, but for the workforce in Iowa as well.
I think also we always have to take into consideration the quality levels of childcare throughout the nation. And Iowa has historically ranked low, very low, in its state regulations and also its quality levels, especially for 0 to 3, birth to 3. So our littlest ones, our most vulnerable ones. So that is always an issue and not one that parents are always aware of.
So let me just kind of open up some of your answers. In-house versus, a center, a facility for childcare. Are they both that expensive? And what are some of the issues facing those who are providing childcare in the home versus a center? You talk about things like low pay. Talk about that a little bit, please.
Just to piggyback off of Kylie's answer earlier, childcare is an expensive service. It's an infrastructure, really. And the business model, whether you are a childcare provider in your home or in a center, the profit margins, as Kylie said, are so slim that you're really not making money. It's kind of like healthcare. It needs to be subsidized in some way to make a profit. And so family childcare is less expensive for families than center-based traditionally. Infant care is always the most expensive. And childcare in Iowa runs between $8,000 to $10,000 a year, the price of a state college. So it's a very expensive infrastructure or a very expensive service.
Anyone else want to touch on that topic?
I think a lot of people don't realize that cost, that annual cost of the first year of life is more than in-state tuition. and how that limits families' options down the line, how really prohibitive that is to giving children a good start when families have so many other urgent needs and, costs are rising. And it's really a tremendous source of stress on all sides.
Also there's family childcare, there's for-profit childcare, there is non-for-profit childcare. The whole infrastructure is confusing, even for those of us who have been in the business for decades. So when we think about families trying to figure this out, that also is a layer of stress.
And I would say Jennifer and Kylie probably can speak more to it than I can, although as a parent, additionally, if you have a child with special needs that needs childcare later in life for full day or wraparound before and after school, those are things that are hugely inaccessible in the state of Iowa. So if you have any type of special needs, childcare is more difficult to find. But then if you have older children that need childcare and high quality childcare that don't traditionally do, that's also an issue for Iowans.
Another related issue is people who need open scheduling, people who do shift work, who have open availability. It's very, very challenging to find a provider that can offer the flexibility that working families need in a lot of cases.
And that flexibility, as a consultant, I have been in and out of hundreds and hundreds of childcare centers in 3 different states. And I have only seen one center with flex care. It wasn't in Iowa.
That's unfortunate. You guys have talked about the cost. And so the pay for those providers, why are we still struggling to pay individuals who are taking care of our most precious assets, our children, especially at such an early and developmental age?
That's where we have the expense of the care, and especially of quality care. There just is not the business model here doesn't work. We can't charge families the rates that it would take to make providers earn a competitive wage and have access to benefits. We have some different stipends in the state, different programs. Some of them are run out of our agency, the TEACH program to help people go to school, the wages program that pays people for their education to stay working in childcare. But we don't have a system-wide solution to expand the profession of childcare where those individuals can make a competitive wage.
And it's also the benefits. I don't have the latest data on benefits in the state of Iowa for childcare workers, but traditionally it has been quite low.
And when Jennifer talks about that, we're talking about people who work in childcare that can't take a day off of work paid if their spouse passes away. And I've heard that recently. They don't have sick leave. Now, some do, some don't. As Jennifer said earlier, everybody's model is different, but we have folks that don't have any time off to go to conferences. They can't be sick or take their children to the doctor. And then we have some childcare providers that in the environment they work do have full benefits and retirement and things like that. But we have to be honest, in the United States, we have about 52% of our childcare workforce that qualifies for a state subsidy, food stamps, low-income insurance, and childcare assistance, among other things.
And the childcare workforce is overwhelmingly female, and many of them have children themselves, and they simply cannot afford the childcare they would need, no matter how much they love the job and are committed to the job, to be able to have safe, quality care for their own children while they're taking care of other people's children.
So in Iowa, we have 1 in 4 children that live in a childcare desert. In rural Iowa, it's 1 in 3. What needs to be done to address the issue? And I know you guys have talked about some of the problems, but what would be an ideal solution to address the childcare desert?
I'm always going to answer about the workforce. That's the seat that I am in as the executive director for Iowa AEYC. We need to support a profession of childcare providers, and that's homes and centers. We need to have a structure of support, state, federal, and public and private partnerships also, that can help someone working in the field get a livable wage and access to benefits, so that we have enough childcare providers that want to stay in the field, that are experts in the field to provide that quality care that we talked about earlier. The percentages are all over the place, but it's 30 to 40%, and I know that's a wide range, of childcare providers in the last 5 years have left the field, and that depends on which national organization statistics, but any of those are alarming amounts of people leaving the field.
We're talking really about a value system. If we value the people who provide care for our children, then there will not be deserts, especially in rural areas. There are people who want to do this work. They just simply can't afford to do it.
And the childcare desert in rural Iowa is reflective of a lot of the other needs of rural Iowa. If you compare the the 5 highest population counties in the state and the 5 lowest, there's a $20,000 difference in median income. That in those most rural counties, that median income is about like 2 parents working full time at a $20 an hour job. And we know that those jobs are difficult to come by. There are a lot of communities where you will not find a $20 an hour job. So the same investments, not only in the child care system, but in the economics of rural Iowa, really have the potential to make a lot of difference in those communities, especially, but to benefit the entire state.
And I'll just add in another statistics here. I worked with the U.S. Chamber Foundation, and it was a 2019 statistic, but I think it's still relevant now that we're coming out of the pandemic, that the lack of childcare cost Iowa nearly $1 billion. And so it's an economic issue, and there is bipartisan support both at the state and the federal level for solving the childcare crisis, but I'm not sure that there's enough understanding of what the issues are. I think that people are light when they say, oh, providers don't make a living wage. Well, they really don't. They're in the bottom 3 to 5%, and they qualify for benefits, and it needs to be addressed. It is mostly women, and a lot of minority women as well. So it's an important thing for Iowa to fix economically.
And this wasn't a crisis that just came about because of the pandemic. This has been here for my entire 25-year career. This is not new. We just keep band-aiding the situation, and it keeps getting worse, and therefore costing more money.
The thing that happened during the pandemic is that centers opened and closed, and homes opened and closed, and it, drew the public's attention because it started to affect the employers. As Jennifer said, it's been going on for a very long time. It just was highlighted a little bit more during the pandemic, or a lot more.
And I think that's continuing to attract the attention of state leadership, because the tighter the squeeze on families, the tighter you're going to see that squeeze on employers being able to attract and retain employees for lack of childcare.
So I want to address our legislators per se. So one, the lack of sustainable or increased funding is one issue. But we had Republican legislators earlier this year propose to increase the allowed ratio of children to workers in a childcare setting from 6 to 1 to 8 to 1. But later changed it to 7 to 1. I take it that was a compromise because of provider concerns. Is that a viable change, or is that, again, one of the Band-Aid issues that you spoke of earlier?
It's not a viable change. It doesn't alleviate the things that we've talked about today. At the minimum, it will slightly impact availability, but at the cost of quality and at the cost of the workforce themselves. We already have the childcare providers overworked, underpaid, no benefits, and we're now solving or trying to solve the lack of availability by making them work harder. And so it was not a compromise on this might work or that might work. And I don't know why that was the thing that they hung on to. We propose many solutions that could make the impact in affordability and quality and access.
And there are providers who choose not to staff their centers or to fill their centers to max ratio because they know that you just simply cannot provide the level of quality care that children need. When you're talking about these 2 and 3 year old rooms that this law addresses, those are children who are either still in diapers or actively potty training. They've got a lot of very immediate social emotional needs that providers know that they really need to be attending to and to be responsive to those needs. So as Jillian said, at best, it makes a couple more slots in your community. And at worst, it burns out your entire workforce and leads to poor quality of care for children.
And typically the centers that are able to keep good teacher-child ratios, those that align with national accreditation standards, are being subsidized by an entity, like a college, a university, something like that. They're not just out there as a for-profit center, financially able to keep good, solid ratios. And the other point I'd like to make about that is the reason that we want low caregiver to child ratios is for this social emotional foundation we want. We are also in a mental health crisis among our young people, even our young children at this point. And this raising the teacher to child ratio will not help this other huge issue. It'll make it worse.
I think it's really important to point out that childcare and quality childcare is a return on investment. And so we're not just talking about, oh, we have a few extra children, but those quality interactions and the base that you make for learning and high quality childcare, as Jennifer said, particularly 0 to 3, but 0 to 8 really as well. That is graduation rates, dropout rates, incarceration rates, special education referrals. Quality early childcare is a preventative to all those lifelong things, including health issues that cost people, cost taxpayers, cost the government much more later on in life. And so it's not just nice to have these low ratios. All of the national experts, pediatricians, our national association, many of the other childcare experts, we recommend these low ratios for scientific reasons, not for they're just nice to have.
And we saw it almost entirely supply side responses to the childcare crisis in the legislature this year. The ratio we saw, allowing families to be charged the difference between the private pay rate and the DHS reimbursement rate. So families that we know can't afford childcare being asked to contribute more out of pocket. And those are important, but this is a 360-degree problem that needs 360-degree solutions. There is some really fascinating research coming out of pandemic stimulus and the way that even just those small investments in a family really contribute to huge dividends to across the lifetime of a child. We saw reduced child hunger, improved parent and child mental health, more safe and stable housing due to the eviction moratoriums. There's a recent study that's come out that showed that providing just a $300 a month unconditional cash payment to a family within their child's first year of life actually increased brain development in that child. So we know that there are investments we can make in families that really do pay that huge return. It has those prevention opportunities, but also those lifetime outcome opportunities.
So you mentioned earlier, healthcare providers can't take time off. So when we talk about training and professional development, how does that play or not play a role in allowing them to provide even better care for the youth? And so now we're talking about the mental health of the provider. And as you mentioned, Kylie, the mental health of the child. I mean, why aren't we doing something, and why aren't our legislators saying enough is enough?
So there's a couple questions there. There's the why that you had at the end that I think we'll respond to, but at the beginning, your childcare providers are getting their training at nights and on weekends to make their minimum wage job. And so they're taking more time away from their families to keep their training up to date. Our organization just had a training over a weekend, and most of the childcare providers took a day off work because their center's closed, but also spent their Saturdays with us. And so it is taxing them even more. And we haven't gotten into and probably don't have time to talk about the mental health of the childcare providers themselves this year. But they're often spending their own time for professional development because it's not built into their schedule, especially when they've been out of ratio or struggling with staffing.
Right. So we're talking about huge burnout rates. We've already talked about that a little, but also I want to point out that when the provider is struggling with mental health or even feelings of being unsafe because they're just so overworked and it just never stops, that the children pick up on that. We are primed as human beings to pick up on how our nervous systems are working and then we pick it up and the children learn. They're actually learning from this provider who's not saying anything or doing anything or talking about her mental health, but the young children pick up on it. Our young children are brilliant in a way that we do not give them credit for.
And I think that we've kind of told ourselves as a society that everybody instinctively knows how to parent and can do it right all the time. And that if you're not, that you're failing in some way. And the same goes for childcare. I mean, there really is an art and a science to being able to provide that nurturing, stable environment, that healthy attachment that supports social emotional development. And our providers are, fantastic people. They're not in it for the money. They do care about children, but they value that training and learning. They put it to use every day. But as the other panelists have mentioned, that comes at a great cost for them. And they're already running on very limited resources. But nobody instinctively knows everything. And we don't have to know everything. There really is great value in parents and childcare providers having opportunities to learn and try new things and expand kind of their techniques and their repertoire for responding to children.
The other thing that most of the childcare systems, centers, homes don't have built in is a substitute. And that became a huge workforce issue during the pandemic. But it was a huge workforce issue prior to that. There wasn't a substitute for the center or for the home if you become ill or need to take some time off. Now, your second part of that was the why, and I'm going to take a stab at it, and then I'll let Jennifer and Kylie too. But Kylie mentioned earlier that Iowa does lead the nation in the percentage of working parents with children under 6. And so we do need women to be in the workforce. But I think part of the why this is not getting addressed is it's traditionally women's work. And we're still told in person, some of our legislators, why don't these women just stay home? And our businesses need to talk about the fact that we also have low unemployment in Iowa. We need our women in the workforce, and it's our women's right to be in the workforce as well. But it's traditionally women's work. And so all the stereotypical things that go with that are an impediment for us solving it.
Yes, it's traditionally women's work, so we're not going to pay women well. There's a punishment here.
I think there is a fundamental misunderstanding of what it is like to be low income and working parent. Just the amount of mental and physical and emotional labor required to be able to handle that open scheduling, to have reliable transportation, that dependable childcare, especially if you work shift work or open availability work. Mm-hmm. I don't know that if you haven't been through it recently, I'm not sure that you can have a full picture of what it's like to be a working parent and to try to make all these pieces fit together.
Well, the other side of that is how many people have a full idea of what it is like to spend 8.5 hours with 10 2-year-olds.
Yeah. We had a policymaker say to us, well, my wife had a birthday party for 8 kids over the weekend. She handled it. And it's, that's not what we're doing. We're planning lessons. There's curriculum. There's all the developmentally appropriate practices. It's a profession. Yes, and there's such a misunderstanding of what it is and the outcomes for children.
Right.
That's unfortunate. And just a ridiculous comment to even make. Sorry. So we know there's issues with, as you say, a pipeline of folks, but then we have the problem of providers not being able to hire. My daughter's 17, so she babysits, but actually working in childcare. So 16, 17, 18-year-old young people or folks with minor drug offenses. They're forbidden to work with kids. Does something need to be done, or is that the right thing for regulators to say, no way?
So one of the bills that just passed actually made it possible for 16 and 17-year-olds to provide childcare without supervision in a childcare center. We're not supportive of that, at least for Iowa AEYC. They were already allowed to work in the childcare center, but with a legal adult in the room. I think it opens up a huge amount of liability for these young children, these teenagers, if something happens in the childcare center, as well as the director. And I'll let the others speak on it. I know we're running out of time.
Regarding the minor drug charges, the way we look at it is that providers are a lot like parents in that way, and that there are a lot of parents who may have made choices at one time that they wouldn't make again today, but those choices don't stop them from being a great parent. And the same goes for potential caregivers. And it's really important that we have good policy that distinguishes between a pattern of behavior that casts doubt on somebody's ability to care for a child, or those past choices that don't define their ability. So that can be things like the seriousness of the charge, the relevance to the scope of work, the time that's passed, and the other relevant history that kind of lets us determine, does this meaningfully impact someone's ability to care for a child who would otherwise be a great influence in the child's life.
I think there's a real difference between babysitting for a few hours and being in a classroom with young children for a long period of time, day in and day out. It's highly stressful. And so the question we have to ask ourselves, are children 16 and 17 years of age, do they have that capacity yet to handle that stress? Do they have the inner resources yet? Like, if we are talking about 40-year-old people who've done it for 10 years saying, yeah, this is tough,
right,
this is a long day, then to throw 16 and 17-year-old young people into the classroom and say, sink or swim. Well, if they sink, everyone's, the young children suffer. And think about that over the lifespan of that 16 or 17-year-old. It is a lot of stress to put on them. It's a lot of pressure.
Absolutely. Wow. Well, thank you guys. We've run out of time. I thank you guys for taking the time today to really try to unpack this issue. Many parents are looking for financial relief without sacrificing quality in the level of care that their children receive. So if there are options that allow for quality care that's affordable and doesn't lower the safety of those who work and take care of the children, then we need to leave all options on the table. Please, Iowa, help us solve this problem today. Thank you and goodbye.
Thank you.
Thank you.
Thank you.